My name is Melanie Batiste, and I'm a board member of PIH Health. I come from a large family of 9 children. I'm number 7, the lucky one. My first passion was to become an air traffic controller. I studied accounting at University of Oregon, but I was actually in the Air National Guard through those years where I did flight operations and then radar operations. I went to work for Deloitte Haskins & Sales. That's the firm I was with before coming to California to work for Toyota Motor Sales. I actually was a member of the project management team that led the move from California to Texas and the consolidation of all of our subsidiaries in one location. So I became very involved with how a business enters a community and what the community responsibilities are. I recently retired from Toyota Motor Sales from Texas, and I moved back to California. I also began teaching at Cal State Long Beach, and I teach strategy and policy to graduate students and seniors. I also was a citizen soldier with the Air National Guard for 27 years. So I retired from them as well and wanted to continue an opportunity to serve my community. And as I moved back, the pandemic hit. And I saw what the healthcare industry had been enduring with the concerns about the pandemic. I thought that's a great way for me to get involved. And so I was with a friend, and she mentioned that PIH Health was looking for board members. And I raised my hand and said, yes, please consider me. In my last position in the Air National Guard, I supported the wing commander in all of the programs that generally support the overall welfare and retention of our airmen. And so one of the things that I really saw that's common with what I see at PIH Health is that deep commitment to the members. I feel I can bring the experience from the military, from Toyota Motor Corporation, and also my experience at Deloitte Haskins & Sales in understanding what the financial requirements are for an organization. There's a lot going on with this industry. There's a lot to consider from a regulation standpoint, from a societal standpoint, and a business standpoint. I feel that my greatest contribution to the board will be to make sure that we're staying aligned with current practices as it relates to strategy and policy. I think I bring an energy level that I think is necessary to invigorate us to, at times, to face difficult situations and do it energetically and optimistically. I'm also very aware of this generation that's coming, that what their expectations are from a business standpoint, an employee standpoint, and hopefully their broad concern for society and the services they receive from a patient standpoint. So I'm hoping that I can bring that perspective to the board, and I can keep that front and center. If it looks like we're veering off the societal needs, I'd like to be able to bring forward what that new generation of societal needs and expectations are.